So here we are. I'm Susanne Storer. I'm a recognized practitioner of therapeutic touch, and I really enjoy helping people naturally release stress and help promote their own healing. I'm a wife, a grandmother, a mother, a great grandmother of a 2.5-year-old, and I bring a lifetime of intuitive nurturing to my practice. I have been a practitioner of therapeutic touch for about 7 years and a recognized practitioner with the Therapeutic Touch Network of Ontario for the last 2 years. I am trusted in my community. Spent many years bringing profound restorative comfort to clients during their most difficult moments. I volunteer my time both at HopeSpring Cancer Support Centre and Hospice Waterloo Region. I also have private practice in Cambridge and also make house calls in Waterloo Region. I use compassionate intention to help restore order, harmony, and balance to the human energy system, facilitating the body's natural healing process to wholeness. We know that if we cut our finger, it'll bleed, but it'll heal. We know that if we break a bone, it will heal. We know that when we experience grief or trauma, it will heal. But there are many ways, especially through therapeutic touch, that we can assist our body, mind, and consciousness to heal easier and faster. So, what is therapeutic touch? The definition through the Therapeutic Touch Network of Ontario, their official definition is it's a gentle, energy-based technique that involves individuals at all levels of our experience, physical, emotional, intellectual, and spiritual. The practitioner uses their hands as a focus for facilitating the healing process. Can be touch, light touch, or no touch. Both are equally effective. So therapeutic touch supports and stimulates your body's own natural healing processes by rebalancing the natural flow of energy and vitality in our bodies. It's a complementary therapy. And in Hospice Waterloo Region, they are accredited for having complementary therapies in their facility. There are a number of different complementary therapies available, and many of them are in Hospice Waterloo Region. And you might know a few of these things: therapeutic touch, acupuncture, herbal medicine, massage therapy, visualization, yoga. I know massage therapy, reflexology, and therapeutic touch and Reiki are all complementary therapies that are in Hospice Waterloo Region. And it's there not only for the residents, it's for individuals in the community, as well as family, caregivers. And when I go to provide it for the residents in hospice, I also provide it for family members as well as staff. So who can learn therapeutic touch? All who have a compassionate heart, are willing to help themselves and others, and a desire to learn. Dolores Krieger was a retired professor of nursing at New York University. She was inspired to develop therapeutic touch when her master's students, nurses, asked her what they could do for their patients when the medical team said, "There's nothing more we can do for this patient." She asked her friend, Dora Kuntz, who was an intuitive healer, if she thought they could teach her nurses to do healing similar to what Dora did intuitively. Together, they developed therapeutic touch as a way to help those who were palliative to get some relief. And they soon found that nurses could learn to do therapeutic touch, and it could be used in many areas to help patients to feel better and support them in their healing. It was the TTNO, the Therapeutic Touch Network of Ontario, that really got TT out of the hospitals and into the community. So now people of all walks of life are learning TT. These two ladies started the Therapeutic Touch Network of Ontario in 1986. So that would be 40 years ago. And in July of 1994, the Therapeutic Touch Network of Ontario was incorporated as a non-profit organization. We have a board of directors, we have curriculum and stringent processes to ensure that the practitioners, especially the recognized practitioners and teachers, follow the same guidelines and are supported through the network. And I am a registered and current member of that network. So there are many applications of therapeutic touch that you can see on your screen. So I'll talk about one experience of mine. Emergency first aid. So last week I was cooking chicken in the oven, 425-degree oven. I had on my oven mitts, took the very hot pan out of the oven, set it on top of the stove, took the oven mitts off, and immediately realized I needed to move it a little bit further in. And I touched it with my finger and my thumb on my left hand. Immediately put them in my mouth, then under cold water, then back in my mouth. And then I started doing therapeutic touch. So my hand is going from my shoulder down past my fingertips, about 2.5 inches above my body. And I'm just moving the energy in my arm and over the burn area. The first 3 or 4 passes were very painful. So I stopped for a moment and then I did it again. And the second time, there was no pain. But you know that water blister that comes up when you burn yourself? That was there. Over the next 24 hours, I would periodically continue to do therapeutic touch. And let me tell you, that water blister never burst, and I have absolutely no scar. There was no breaking of the skin, nothing. And after about the first hour, there was no pain at all. That's my emergency first aid.
Wow.
So, anxiety and stress management. So, how many of us like to go to the dentist? Favorite place in the whole world, right? Not. So, I over many years of my life, many decades, I would be so tense and stiff, and my jaws would ache, and I would be so anxious the whole time I'm in the dentist chair and probably for a day or so afterwards. So now what I do, as soon as I get into the dentist chair and he's ready to put anything in my mouth, I start doing therapeutic touch. I put my hands just about eyebrow level in front of my body, 4 to 6 inches, far enough away that I'm not impeding the dentist or the person who's doing cleaning. So I'm just going down the front of my body and pushing out past my lap and imagining the energy going down to my feet. And I just continue doing that. And I breathe easy and I don't do it in haste. I just continue to focus on that. And let me tell you, the dentist has already suggested that I come and do that for his patients because it would help them relax. And I agree with him. This is something that anybody can learn how to do. You need to understand what you're doing. You need to have the right compassionate frame of mind to know what you're doing and not just kind of wave your hands and think, oh, that's therapeutic touch, because it's not. Okay, one more story about hospice. I had a friend of mine who was a resident there, and I said, I have to go and see her. And when I arrived, her family was trying to come from different parts of the country. Her one son had arrived, but he was very anxious about the whole situation with his mom. And she was trying to tell the nurse something. She was trying to articulate something. But because of her current condition, she was unable to really get the nurse to understand what she was saying. I said, so how about we just do some therapeutic touch? In a hospice setting, I I visualize butterfly wings on the tips of my fingers. So gentle do I need to be with these individuals who are on the last part of their earthly journey. I did a few passes above her, not touching her, but above her, from her head, down her body, towards her toes. And I just did a few passes like that. Within 30 seconds, you could see her whole body relax. I am not kidding. The relaxation response was almost immediate. She wasn't agitated anymore. Her breathing settled down. And the effect of the therapeutic touch that I was doing for her was also having a positive effect on her son on the other side of the room. I
Hmm.
wasn't in her room for 10 minutes, and it made such a profound difference. So that's my story about hospice. So, how do we begin? We quiet the monkey chatter of the mind. So, therapeutic touch is never suggested that it's going to cure anything because it can't. It doesn't. That's not what it's for. When I start, I do my simple breathing. Breathe with me. So, through your nostrils in, you can notice the breath. It's cool on the in breath and warm on the out breath. And a few more breaths in and out. In and out. And how does that make you feel? Just doing that. It helps you feel calm and peaceful And by becoming calm and present, we are still able to connect. We are able to connect with and hear the still quiet voice within of our inner healer as practitioners. And it puts us in the moment, ready to deal with whatever comes up in the session. That's the feeling we bring to our healing partners, the individual who's receiving the therapeutic touch session. It's a tool for stress management. And you can take that home with you. You can do that anytime. It also allows that peaceful feeling, also allows you to access your inner healer. So, assumptions underlying therapeutic touch. Everything in the universe is energy. In energy, health flows freely. Illness or injury changes the energy field, and the ability to heal is an innate in all living things. Therapeutic touch activates or enhances our inner healer. If you have a stream that's flowing and there's nothing in it to impede the progress of the water, it flows freely and it's great. Unfortunately, as life affects your energy field with a rock here and then a tree falls in, and then there's debris and more rocks and oh, a dead fish, and all of a sudden that stream isn't even flowing anymore. What therapeutic touch does is helps remove the debris in the field. It helps clear that debris out. The other analogy I have is a garden hose. If your garden hose is wide open and it's full on flowing, there's no problem with getting the water to the plants. But if you kink the hose or put a rock on it or step on it, that affects the energy flow. And different things in your life will also affect your own energy flow. Grief, a traumatic experience, a child loses a pet, someone loses their job, or a parent, or a good friend. All of those things can deplete or seriously reduce your energy flow. So, activating your inner healer can help with all of those things. These are just basic assumptions. Healing is more than just physical. It's emotional, spiritual, mental. Again, we do not do the healing. I do not heal anybody. What I do is I support the healing partner by restoring the field to order, balance, harmony. They're components of wholeness. And we focus on these qualities when we activate the inner healer of our healing partner, the individual receiving the therapeutic touch session. Therapeutic touch is holistic. You do not need a prescription for it. There's no chemicals in it. It is amazing. And what are the effects of therapeutic touch? Research and clinical experience have shown its effectiveness in promoting a relaxation response, reducing stress and anxiety, managing pain, improving sleep, activating your inner healer. It's a cascade of effects. The relaxation leads to less stress, which leads to pain management, which leads to improved sleep. And the end result is a sense of well being. All this is activating your inner healer. The Therapeutic Touch Network of Ontario, Therapeutic Touch Network, therapeutictouchontario.org, sorry, has a research section that anyone can access. You click on learn, you click on research, and all of the research that is done has been compiled and held there in our network website. So I'm going to give you a few pieces of the research that are there, studies that have been done. This is not anecdotal. These are specific research studies that were done, very well documented. So, this particular research study at the University of Connecticut was that discovered that therapeutic touch has significant effects on mouse breast cancer metastases and immune responses, but not the primary tumor size. So, mice were injected with metastatic mammary cancer cells. Mice received either therapeutic touch or mock therapeutic touch twice a week for 10 minutes by two experienced therapeutic touch practitioners. Therapeutic touch affects the outcome, significant effects on immune response and metastases. Therapeutic touch, obviously, was affecting the body's immune system and moving the body toward health. Notice how I didn't say cure, but better health. So this one is pretty intense, especially when you're talking about cancer. So this study was done, and the end result was in the cultures receiving therapeutic touch, growth of the bone building cells was enhanced, while both of the bone cancer cells was inhibited. Though both types of cells were grown in a culture medium that both types of cells thrived in, but in the cultures receiving therapeutic touch, specifically, the growth of the bone building cells was enhanced, but growth of the bone cancer cells was inhibited. It seems that the energy field is intelligent. The effects of therapeutic touch on the cells depends on whether the cells are those that move the body toward health or not. That is the work of that is the inner healer at work. So, therapeutic touch and pain. During this study, the therapeutic touch was applied twice a week for 8 weeks. It decreased pain and stiffness of osteoarthritis in the knee, did not affect the range of motion or the stability of the knee. In the same way that I use therapeutic touch to help my hands when the arthritis is starting to get a little achy, it helps and the pain subsides. Doesn't get rid of my arthritis, but the effect of the arthritis, making it hard oh, to cut my food or do certain activities, play the piano. Definitely less difficult when I use therapeutic touch. Now, this is a very interesting study regarding dementia. The study design, it's a randomized controlled trial, double blinded. It was a setting in a nursing home extended care facility. 57 residents of 3 long-term care facilities, and therapeutic touch was conducted twice daily for 5 to 7 minutes each time by a trained practitioner who used contact therapeutic touch on the neck, back, and shoulders. Placebo therapeutic touch was conducted by a person untrained in the technique who performed mental mathematical calculations rather than focusing on the patient. Trained observers unaware of the treatment assignment recorded patient behavior every 20 minutes for 10 hours a day for 3 days before the treatments and for the 3 days following the 3 days of treatment. Now, this research was highlighted in Info Poems. It's a daily doses of knowledge presented by the Canadian Medical Association. POEMS means patient-oriented evidence that matters and refers to the summaries of valid research that are important to physicians and to their patients. Ideally, poems represent information that has the potential to change the way physicians practice medicine. And the short duration therapeutic touch really decreased the behavioral issues with patients with dementia. Yelling, throwing things, very profound. So, therapeutic touch, what to expect? It's an individual permission-based session. 5 to 10 minutes with a 20-minute rest period. Or although I have done 20 minutes with a 15-minute rest period. It depends on the healing partner's field. When I, as a practitioner, do my assessment, fully clothed, be covered with a blanket, can sit in a chair, lying down, adaptable to any position, and light touch for grounding purposes or no touch. It's based on the healing partner's preference. So I center myself as a practitioner. I make sure that I'm all there for the client, for the healing partner. And then having my hands several inches above their body, I scan or assess their field. Sometimes I come up with a cue that, oh, so you're a little bit cold here. Your energy is depleted in this area. Or I'll feel something that's very staticky. It looks like something is stuck there and it needs to be smoothed out. But I don't always receive a cue on the assessment. Sometimes it's not until I'm actually rebalancing the field, and that's what I do. The motions are similar, the hand movements are very similar, but always from the top down to the bottom. And when my healing partner is fit, and when I'm finished the actual treatment portion, I remind them before the session that I'm going to touch their elbow when I'm finished so that they know I'm done without me disturbing their reverie. In case they fall asleep, which I take as a great compliment, and then I monitor their rest. I reflect after a session to see, is there something that I could have done differently? Did I do everything that I needed to do? And I always after I do the rebalancing, do an additional assessment before I end the session. So that there are teachers who teach the current curriculum, Foundations of Therapeutic Touch, and there's Inner Processes, and there's one more which the name escapes me. But I am working on a Therapeutic Touch for Self-Care series. Crystal Hawk, one of the founders of the Therapeutic Touch Network of Ontario, and another teacher, Allison Cook, wrote a book, Therapeutic Touch for Self-Care. And I'll be doing workshops based on that book. It's just not quite ready for me to do. And I'm going to leave you with this, a quote from the Dalai Lama. And that's the end of the slideshow.